And can I just thank all my fellow panelists for joining today? Really appreciate it.
Absolutely, Tim, and I echo that thanks. So thank you to all for joining. I believe we've got Dr. Erin Sturrock on the webinar today.
Yeah, hi. So my name is Erin Sturrock. I'm one of the neurologists. I work with the Wolfham's team.
Thank you. I believe we have Dr. Larissa Carrick. Apologies for if I've said your name wrong.
No, it's absolutely fine. Everybody knows me as Larissa anyway. So thank you for inviting me. I am the Rare Disease Lead for Birmingham Children's Hospital, and I am a kidney consultant. And I think the reason Tim asked me to be joining you here today is the fact that I've been doing all the shielding letters for the whole of our Birmingham Children's Hospital. So I've become a bit of an expert by experience, a bit like yourselves really. So I may not know everything, but I'll give it a go anyway.
Thank you very much, Larissa. It's good to see you this afternoon. We also have Sarah.
Hello, I work in the psychology team at Birmingham Children's Hospital. I've done a few of these webinars now, so hopefully it's been helpful. I'll be doing the kind of wellbeing side of things today.
Thank you, Sarah. And then we also have a new guest with us this afternoon, Angela.
Hi, I'm Angela Cartwright. I'm acting consultant in health protection with Public Health England, and my role, hopefully I can help to interpret some of the guidance and how it's changed.
That's fantastic, and we've got lots of questions on that this afternoon, as I'm sure you've seen. And we also have Marie and Sue sitting in mass in the hospital. Would you like to introduce yourselves, ladies? You're on mute.
Yeah. I'm Susan. I work at Birmingham Children's. I'm the diabetes and Wolfram nurse.
And I'm Marie McGee. I'm the transition coordinator for the team, but I also do some work for Wolfram Syndrome UK for their carers project and their BDB project as well.
Thank you, ladies. And finally, I think it's Denise that we haven't heard from yet.
Yeah, sorry. Hi, I'm Denise Williams. I'm the geneticist across both the services. And this is my first webinar, so I'm looking forward to it.
Well, you're very welcome. Thank you very much for joining us this afternoon. Have I missed anyone? Is there anyone else? No? Okay, so with that, I'll move to the first question. So our first topic for today is around COVID with all of the changes to the restrictions. And the first question, I think we probably just need a brief response, but what symptoms other than cough and flu could a WS or anyone else experience so that they know when they should request a test for the virus? Tim, can you start us off?
Sure.
Or Angela, would you like to?
I will start, but I will probably fairly quickly go on to Angela, I suspect, for this as well. The missing bit was fever there as well, so I think if there's a good going fever, I think that would be important. And there are a range of other symptoms, but I will defer to Angela before I go through those. Angela, I'll pass you.
Okay, so the sort of key symptoms in terms of the case definition at the moment is the cough, shortness of breath, fever, so we're sort of looking over 38 degrees, and an interest in loss of taste and smell. However, many people with COVID report other symptoms, so particularly fatigue, muscle aches and pains, and those general flu-like symptoms. So now that testing is much more available, it's worthwhile if vulnerable people do develop any of those symptoms that they arrange testing.
I've also got a couple of bits to add. There's actually been a Lancet publication, I think it's just last week, looking at a cohort of European children, and what they've said is 16% of children were completely asymptomatic, 65% had temperatures, 54% had an upper respiratory tract infection, so basically sneezing, snotty nose, that sort of stuff. They're kind of cold symptoms. 25%, so a quarter, had lower respiratory tract infections, so that means like a chest infections type symptoms. 22% had gastrointestinal. So that is something that we are seeing at the Children's Hospital a lot more. And then a third, nearly 28%, had a headache. So that's another symptom, along with the ones that Angela said. And then, of course, in a very, very, very small proportion of children, you also get some skin manifestations, and you get this kind of toxic shock thing. We've had lots of questions from GPs and from families about that. Now, that is extremely rare, and when children do have that, they are usually very sick, and you will know it straight away. So and it's basically very high temperature, you often starting with GI symptoms, so diarrhea, and then they just feel very dizzy because their blood pressure is very low. So, but that is incredibly rare. At the Children's Hospital, we've had 36 patients, but only a very few actually ended up in ITU, and everybody made it through. So,
thank you. And could anyone is there anything from a WS point of view that they should look out for if they're experiencing these symptoms? Is it likely to disrupt their glucose or make more diabetes more difficult to manage?
So the only thing to add is, of course, that some people with Wolfram may not have much of a sense of taste or smell anyway, so that might not be such a reliable symptom. But anything that causes a fever and a cough is likely to put the blood glucose levels up and make the glucose more difficult to manage, as you would expect. So really important to talk to Susan Gleason, local diabetes teams, if you're getting problems with the sugar management as well.
Thank you, Tim. Thank you for that. So now there's some questions around safety, and Angela, I'm going to direct these questions to you, and others can jump in as they feel they'd like to. There's a lot around different aspects of safety. So firstly, is it safe for WS people who are considered vulnerable or indeed extremely vulnerable for COVID-19 to go out now? And if yes, what protective measures should they take?
Okay, so the guidance has changed to say that people who have been shielding, but potentially not in the extremely vulnerable category, can now go out. And they're talking with that in terms of going outside with your own household, so not necessarily going out to meet other people at the moment. The precautions that you need to take is particularly the social distancing, so making sure that you're not getting close to other people, that you're not getting close to anybody who's got symptoms of COVID, and that we're continuing with hand washing. That guidance is changing from August, so from the 1st of August, the government are what they call pausing shielding, and they're therefore saying that people can do things like going food shopping, children can go back to school, and people can sort of meet in slightly larger groups again outside. However, I think you still need to remain cautious that COVID is still circulating within the community. There's much lower levels than there was maybe going back to April, but actually people still need to sort of take notice of, particularly if they're inside with a lot of people, and anybody that, you know, avoiding anybody that's ill and avoiding crowded places.
Thank you. Anyone else have any more comments to add to that?
In terms of the patients with Wolfram, as far as I understand, the reason, and Tim can correct me, the reason that some people, I don't know if all of you have been shielding, but the reason to shield is because of the neurological problems, as well as the diabetes. Although I think diabetes in children doesn't necessarily increase the risk of complications, according to the recent kind of review that the Royal College of Pediatric and Child Health did, and the stuff that the stuff that was advised to the Chief Medical Officer for England. So I think most people will probably come into the kind of group B, which actually have to be individually reviewed. So I defer now to Tim for with regards to the exact advice.
Yeah, you're right, Larissa. At the beginning of this, Dr. Ben Wright, my adult neurology colleague, Veronica Diaz, and ourselves considered Wolfram and thought that they would be in a highly vulnerable group, but not a shielding group. And the reason is because most people with Wolfram syndrome, almost everybody, they're not immunosuppressed, so they've got an immune system that works well, and they're not on medicines that are going to affect the immune system. So you're absolutely right. Most people would just be asked to be in a vulnerable group from that. And that diabetes itself wasn't a reason to be shielded. And we explained that in a previous webinar as well, really. So I think it's just worth emphasizing. Some families have decided to shield themselves, but we haven't put them in a category A according to the RCPCH.
Thank you, Tim. So going back to your, based on your comments then, Angela, the question around are people able to limit them, should people continue to limit their interaction to one person and stay outside with 2 metre distance? At what point will that be able to change? Is that when the shielding ends at the end of July, just to clarify?
Yeah, so for people who are considered vulnerable, they are saying yes, people can go outside, but just with people sort of from your household or people from your bubble. You know, so if you've maybe got a single parent with a child, they could make a bubble within another household. And then they're talking about really from August that vulnerable people will be able to mix a little more freely, but they're talking sort of a maximum of 6 and still maintaining social distancing.
Thank you. So in terms of WS affected people being able to go back to school, college or university, what would be the guidance around that?
Yeah, so nationally, they are saying children that are considered vulnerable from the 1st of August can go back to their educational establishments. However, I would recommend that being a discussion with their clinician who knows the needs of that individual, and also for parents to be looking at, is their child able to stay socially distanced? So particularly looking at our younger children and anybody who also has a learning disability, they may find it more difficult to maintain that social distance. So whilst the national guidance is saying yes, all children should be going back to school, I still think as a parent myself, that needs to be an individual discussion with the clinician and with the parents thinking about the needs of their child.
What we've been advising from Birmingham Children's Hospital, because I've actually been advising the whole hospital, so the ones that we are still recommending to shield are the some immunosuppressed patients, some of the cancer patients, and some of the patients that have got breathing problems. And I suspect that some of the adult and some of the older WUF syndrome patients will be included in that. So if you can't protect your airway properly, and then some other ones with weird and wonderful things like immunosuppression, kind of rare disease types, such as combined immunodeficiency. So for majority of, I think, the WUF patients, I think you can get out there and you can get back to school. I think a lot of parents are really worried about getting back to school, but as a pediatrician, I think the risk of the virus is actually lower than the risk of having mental health problems and actually not being with your friends and also with your support group from school. So I've been talking to a lot of families, just of my own patients over the past a few weeks when things have changed, and certainly everybody is very scared. One thing which I should have said right at the beginning is very, very few children are affected by COVID. So unlike adults, most children are absolutely fine, and of those that I was saying about the different symptoms, that is a very small minority. So majority of children are absolutely fine, and I'm recommending for most of my patients, apart from the ones that I mentioned before, that they should get back to some kind of normal, restart. They will be anxious to begin with, so hopefully we'll get some psychology advice about that. But I think our main emphasis now is to try and get people back to some kind of normality, so that they don't feel isolated along the whole holidays.
Thank you. And there's been lots of questions around this in terms of what precautions should WS affected people take when going out and about. Are you able to comment on that?
Yeah.
Sorry.
I don't know which of us wanted to speak.
Larissa, would you like to start, and then maybe Angela can then take over?
From the pediatrician's kind of point of view, hand washing is the most important thing, and that has always remained the most important thing. The wearing of masks is more to protect other people than to protect yourself, although there is some protection there, and of course social distancing. So if you can't socially distance, which is, it's been the advice has been changed from 2 meters to 1 meter. However, if you look at the evidence, 2 meters is better than 1 meter, but they've kind of compromised on the 1 meter. So if you can't socially distance, by 2 meters, then wear a mask. So in places like public transport, it's now mandatory anyway. In shops where there's too many people, most important thing is carry around a little hand sanitizer, and then, because a lot of transmission will be from things that people touch, so that remains the most important thing.
Angela, would you like to add anything further?
Yeah, and I'd just echo really those thoughts that things like hand washing, respiratory hygiene, so ensuring that you sort of catch any sneezes or coughs, and wash your hands afterwards, washing your hands when you get back into the house, and again the social distancing. And like you said, public transport, the guidance is to try and avoid public transport where possible, but if you do need to use public transport, then people should be wearing masks.
Brilliant. Thank you, Angela. Gina, may I just suggest that there is a chat function on this webinar, and perhaps if any families have got any comments or questions as we go along, would it be all right for them to sort of use that chat bit, and then we can keep an eye on it and raise them as we go along? Is that all right, Gina?
Certainly can. Yep.
Brilliant.
We did that last time and it worked very successfully. You mentioned public transport, Angela. So how long should people continue to avoid public transport at this point?
Yeah, so there isn't a sort of end date at the moment, and I think that the situation that we're in is that there is an awful lot less community transmission of COVID than we were seeing sort of back in April. However, you only have to look at the sort of situation in Leicester and other parts of the country. It might change, the guidance that we're giving about whether people are going out or staying home, that might actually change over time. And at the moment, there isn't a sort of end date for public transport. They're sort of saying for short distances, walking or cycling, if people are able to do that, or using cars, or actually sort of using taxis rather than using things like trains and buses. But obviously for individual families, they may need to use public transport, and that's where, deciding to sit further away from other people if possible and using masks would come in.
Brilliant. Thank you very much for that. So are you able to give any comment on why the advice for vulnerable and extremely vulnerable people has changed?
Yeah, so that goes back to the balance between the risks of sort of being outside the home and being in public from community transmission. That has reduced dramatically. It only feels like a few weeks ago at Public Health England, we were getting literally hundreds and hundreds of notifications every day of cases of COVID. Now we're just down to sort of 2 figures, and that's for across the West Midlands. But then again, you look at places like Leicester, and obviously they've now got much higher numbers. So it's balancing the fact the numbers have come down, but also actually keeping people shielded, keeping people at home, people not going to school, not going to work, obviously have an adverse impact on people's health and general well-being. We're all sat at home, so I'm currently shielding, which is why I'm home. And actually, you do miss your friends. It does have an adverse impact. You can't exercise as much. We all sit here nibbling all day, which isn't great for the waistline. And so it's balancing the sort of risk of COVID to the risks of the adverse effects of continuing to stay home. So now that community transmission's dropped, actually the risks of staying in probably outweigh the risks of going out. But again, that might change, and we might have sort of localised times when actually we need to tell people to stay home. Similar
situation to what's happened in Leicester, I assume, is that?
Absolutely, yes, yeah.
the other thing that has changed from the beginning of the pandemic, at the beginning, we didn't actually know what this disease was doing. We had information from China and we had information from Italy, but we couldn't really trust some of the information that was coming back. We knew that children weren't badly affected when Italy started telling us information, but we didn't really know. And most people assumed that this was like flu, and flu affects the young. And now, 3 months down the line, we've learned that actually children aren't affected. They are, they're hardly ever affected, I should say. At the, in terms of our patients, say my kidney patients, we've got a lot of transplant patients, dialysis patients. The dialysis ones seem to be more at risk, but we've actually only had 2 of our 20 dialysis patients that have had COVID, and they were absolutely fine. They had a bit of a cold, whereas actually the staff that ended up catching it, this is right at the beginning, were much more badly affected. So we know so much more now about this disease compared to before, and actually it's really, really reassuring. Again, at the beginning of the pandemic, we at the Children's were ready for an influx. Even all the kind of specialist teams were on a rota to come down and help in the emergency department, but that wasn't the case. So we've got a lot more information about this disease now.
Thank you. And we just had a question come in through the chat actually, which is asking whether you're recommending that we all use the COVID Join Zoe app. Do you have any comments on that?
As far as I'm aware, there isn't a sort of national contact tracing app. So there's a few different apps around that are claiming that they're doing contact tracing, or apps that are doing symptom studies, but actually there isn't a sort of NHS app at the moment. So we're not suggesting that people, add these apps at the moment.
Yeah, same from here. So the Zoe app is a research app from King's College, Hospital, and the University of London. So they're doing a research of kind of tracking symptoms, but that's not the contact tracing app. So,
Larissa, is that the same as the COVID-19 tracing app that comes from Imperial College? I think it is, that I've been following. Yeah.
It's not Imperial. The Zoe app is actually from King's College. I'm not sure if there's another one from, I know that there is a study coming out of Imperial that they are doing lots of monitoring. So there are loads of research projects going on at the moment on this.
Thank you. So now if we look more at the carers in terms of COVID, so is there any, should carers be concerned when it comes to going out and about, and what sort of steps should they take? Is there anything they specifically should bear in mind as carers when considering their movements over the next few weeks? And Angela, would you like to take that?
Yeah, so it's quite interesting that even when sort of vulnerable and extremely vulnerable people were identified for shielding, that didn't apply to household members. So household members were still expected to go to work and carry on sort of their daily business. And the vulnerable person was sort of told they've got to socially distance from the rest of their family. Now, if you're a situation where you're just, a couple or adult children, that might actually be possible. So my teenager spends a lot of time in his room. He's socially distanced. But actually, if you're looking after much younger children, I think it's impossible to care for young children and stay 2 meters away. So that there isn't any guidance particularly around carers, but I think it's everybody just being aware that if they were to contract COVID, it would have an adverse effect, possibly more actually on the carer than it would on the child. If we're talking about a child, I think this one's a 30-year-old son, isn't it? And how they'd be able to care for them, and who would be able to care for them if they became ill. So I'd still give the same guidance around just being really alert to your surroundings and maintaining that social distancing and not going out unless you need to.
So what about for our WS affected members that have more complex needs, that maybe have carers or support workers coming into their home, and that's obviously stopped during the COVID pandemic? At what point do you anticipate that would be able to be started, and that, you know, that in their situation they would be doing one-to-one caring, and what measures should they take, and what activities would they be able to do?
So carers for other settings are all using PPE, and I think there's a question about how appropriate that would be for children and young people with sort of WS in terms of, you know, if somebody was actually coming to do an activity with them and wearing PPE. So again, I think it's that individual risk assessment, and as your colleague says, you know, actually COVID is fairly mild in most children, even those children who might have multiple and special needs. So again, I think the risk of COVID needs to be weighed up against the risk to the children and their families of actually not getting personal assistance and not getting that support that they need. So that should be really something that is introduced, you know, fairly soon. In terms of contact tracing, if somebody did become ill, it'd be quite easy to work out who they've been in contact with, and then we could get the appropriate advice and testing out to them.
Thank you. Gina, I was just going to say that I think there's quite a few adult patients with Wolfram on the call, and I wondered whether Erin wanted to share any experiences she's had with other adult neurology patients she's looked after in relation to this.
That would be fantastic.
I think I'd sort of really echo the same things, really. I think you know, I think if you're, you know, with complex care and needs at home, I think really people should be looking at things like, you know, obviously PPE for carers. I mean, it's you know, you know, I'd say it probably, you know, obviously will depend a bit on the WS individual as well. You know, I think from a neurological point of view, I think we'd be, you know, looking at the kind of guidance, I guess, and the relative vulnerabilities. It's more of a concern, I think, when people have issues with swallowing, for example, as well, where those individuals become, you know, much more in the shielded group, whereas, you know, perhaps, you know, for those with maybe less severe swallowing issues, or individuals that may be, you know, more with sort of diabetes, maybe not quite so severe end, they probably fall more into the sort of vulnerable categories. But I think, yeah, no, I mean, I would sort of really echo the same things. I think, you know, PPE, where people need kind of one-to-one support, you know, I think in the question it says about complex needs and having, you know, someone obviously at close clinical proximity, which would probably suggest that individual is probably within that shielded category because they're quite poorly. I think PPE would be important, you know, so yeah, I would suggest the same things, really. Same approach. Okay.
No, that's great, and there's a few bits coming up in the chat, Gina, I think, as well.
Exactly. Yes. Would you? So some carers, some adults and young people have personal assistants who guide them when they're out. Can this be restarted? Angela, would you just like to comment? I know you put something in the chat, but could you comment?
Yes, and I think those are the cases where actually PPE may not be as necessary, because although you're providing that sort of one-to-one support, what you're not sort of giving social care. So it's not the same as if you think of domiciliary care, that are maybe going house to house to house to get people out of bed, or to help them wash, or to help them eat, whereas the sort of personal assistants tend to be seeing fewer people. And might be a little bit more of a distance, and not having such sort of intimate relationship in terms of, you know, that physically intimate relationship with people. And it might be a discussion that actually families and individuals want to have themselves, whether they're happy for their PA to wear PPE, or whether actually that makes them, you know, it makes them quite noticeable in a public place if they've got somebody with them wearing PPE. You know, so if somebody is taking another adult sort of bowling, or for, you know, whatever activities they want support with, again, I think that's an individual decision, but the sort of domiciliary social care, they should definitely be wearing PPE.
Do you think we're at a point now where that PA support could be started again?
Yeah, I think we're probably on. I think it may need to stop depending on sort of local outbreaks. So it might be that people have a PA that comes out to their home and actually does activities with them at home, as opposed to going out to a public place to do them. And again, I think going forward, there is going to be potentially more sort of local lockdowns as opposed to something that will affect families nationally.
Thank you very much. Does anyone else have anything to comment on that?
I've been advising our families with other rare diseases that they certainly can restart that, and I've been doing quite a lot of letters of support, you know, from just kind of referring back to question 7 about, you know, the carer who's 60 and overweight and all the rest of it, and the GPs not being helpful. I mean, sometimes a doctor's letter goes a long way. So and talk to your employer as well. So so sometimes a lot of schools are actually wanting letters from consultants. So yeah, we've been doing those. And so if you're stuck, don't hesitate to contact your team, because they're likely to be able to help.
Also, sorry, can you hear me? I think there's I using this. You know, I think also with carers and things like that, and in this case, I think in question 7, you know, I think it's also about sort of risk assessment, as you mentioned, within the sort of the company or the business that's involved through their occupational health. I would have thought would be important for that individual safety as well.
Thank you. And just to clarify, with the guidance that we've been talking about and the advice, would that apply throughout the UK? Because I know there are some differences between the different principalities, and we do have members that are outside of England, so maybe experiencing different measures and restrictions in terms of the COVID. Angela, could you comment?
Yeah, certainly for the sort of 4 nations. Some of the things are similar, but I agree some of the timings and some of the guidance is slightly different. So do check your own government's website to see what they're suggesting. And some of that difference is political, and some of it is just due to the nature of how the infection has spread in different parts of the UK. But I echo what Erin said about workplace assessments. So all workplaces should be doing a particular COVID risk assessment for their staff, and particularly for any staff that could be at risk. So those that are a little bit older, those with underlying conditions, and those from the Black, Asian and other minority ethnic communities, all employers should be doing a risk assessment before staff go back to work.
Thank you. That's really helpful. So I'm going to turn now to mental well-being, because we had quite a lot of questions for different members on those topics. So Sarah, I'm going to direct this question at you. If a WS affected person is feeling anxious, who can they go to for support? And how can they communicate with them, given that people with WS experience visual impairment and may in some cases have deafness as well?
Yeah, so in terms of who they can go to for support, as far as I'm aware, all mental health services are still up and running. We're just doing things differently, remotely, video calls, telephone, etc. So the best, well, every kind of area is different and the pathway is different, but usually the best way to go through is to go through your GP, because they'll be aware of all the local services in your area. Also, alternatively, some places do accept self-referrals. So if you just Google NHS mental health support and whatever area you live in, you might be able to self-refer rather than going through the GP, but it's kind of up to you really. There's also plenty of charities as well. So I know that there's like the RNLIB or something, the Royal Institute for the Blind. If you go on their website, they've got absolutely tons of information about local charities, and I think certain charities do offer like counselling and therapy as well. So yes, that's where you can go to for support. Obviously, reiterate that at Birmingham Children's Hospital you will have access to the psychology team if you're a patient there, so you can always come through to us. In terms around the communication side of things, it's really tricky, and I imagine it's really frustrating for people who are visually impaired or potentially hearing impaired as well. And I imagine that it's really frustrating that a lot of other people seem to be on Zoom and enjoying that kind of thing, and you feel that you don't get a kind of benefit from that. I guess there's some things like practical ideas of like maybe sending a letter or sending a voice note or a recording of something, spending quality time with the people that you live with, so kind of making special time to do things that you enjoy with those people, so the people that you can be around. And I guess there's ways to connect with others that don't specifically involve being around others. So ways that you can feel connected, such as, I don't know, making a family tree, or kind of mapping out your support network on a piece of paper, or talking about happy memories of times where you've connected with other people. So all those other kind of activities you can do where you feel a sense of connection, but you might not necessarily be around them. But it is really tricky. It must be really frustrating to feel limited by that. I guess at the moment, if connection is important to you and it's something that you're struggling to find, obviously try the things that I've just suggested, but also maybe think about what else is important to you. Because if we're kind of limited with that, what other things can we be doing? So what matters to you? Think about what's important. So is that creativity, or being helpful, or what other things that matter, and how can you hone in on those things at the moment when connection is less available to you? But yeah, as I said, it's really hard, and hopefully, as we've said, we are hoping to start seeing people a bit more now, so I'm hoping that might make a difference as well. But keep at it, and hopefully there's been some helpful tips there.
Can I just add something there? There's so there's something called the Improving Access to Psychological Therapy, so IAPT, which you can just Google, and this is a sort of a self-referral thing that can be useful, and I think they've made some preparations with regard to the COVID virus, and anyone I think can pretty much self-refer to that as well. So that's useful for kind of counselling, and most likely I suspect they'll get a spike with regard to the COVID issue. So that may be something useful.
Yeah, that's great. I actually used to work for IAPT. So they have a IAPT team in every area. So there should be one local to you, and it's one of the NHS services offered for kind of anxiety, depression, difficulties like that. So yeah, that's a great idea, and you can most likely self-refer as well. So yeah.
Thank you, Sarah.
Can I add just something really quickly? The kind of things I recommend to our families who are not known to mental health services is actually the stuff that's written in the shielding letter from the government. So Heads Together, Young Minds, Mind Itself, all of those charities are really very helpful, and especially for people who are not known, and you don't want a full referral, but actually you want to go and have a look and just get some information. So those are really good, and they've got COVID specific information. The other source of support is the volunteer scheme. So when the government asks for all these volunteers to come forward, they're actually being quite underused. So you could and they can do befriending, they can talk to you, they can ring you regularly. So that's another source of support. And again, if you go on the gov.uk and COVID part, you will be able to find that that particular link.
Thank you, Larissa. Does anyone else have any more comments on that before we leave the topic?
Yeah, just to say, Dr. Veronica Diaz has joined as well. Thanks, Veronica, for coming in. So I'll make sure Gina targets some questions towards you to answer as well. And also to say that Marie McGee, who's on here as well, I think, Marie, you very kindly put together a resource list, which I think went on some of our shielding letters, Marie, which incorporates some of the things that Larissa's just referred to as well. And if not, perhaps, Gina, you and I can chat back with Tracy Lynch to make sure that that's available for the families through the website. We can do that.
Yeah, I can resend it, and just check, as you say, just check with Tracy if it's on there. If anybody wants to email me directly with any specific resources they would like as well, I'm quite happy to look them up for them too.
Thanks, Marie.
And Veronica, would you like to introduce yourself?
So apologies, I'm a black screen, everyone. I'm in the trust, and so I don't have a webcam, unfortunately. My name's Veronica Dias. I'm one of the endocrine consultants based at Birmingham Children's, and I help run the Wolfram Clinic with Tim, and I'm the local investigator also for the Treat Wolfram trial. So hi, everyone.
Gina, you're on mute.
I'm sorry, Tim. I'm trying to manage the cameras and the chat all at the same time. So there were some questions. So apologies. There were some questions on the chat. So what would you recommend when a child returns to school when they have several different support assistants throughout the day? Angela, maybe, I know you put a comment in, but maybe you could just briefly comment so everyone can hear that.
Yeah, so all the schools are trying to put into place what they're calling bubbles, which is where you've got a set number of children and a set number of staff, be they sort of teaching assistants, therapy, teachers, that stay together throughout the whole of the school day, and they're calling them bubbles. And the reason for that is because if one person becomes is confirmed with COVID, then everybody else who are close contacts have to self-isolate for 14 days. So actually most schools are now sort of drawing up plans to do this, so that actually people will have consistency. The children will just have, you know, one or two. If they need a therapist, a teaching assistant, a teacher, they will all be part of that same bubble. Now that means if one person becomes poorly, we know exactly then who to isolate. So they stay together at playtimes, at lunchtime, for any sports lessons, but that bubble stays together.
Thank you very much. So now we have Veronica and Tim on the call. I'm going to move the questions over to the clinical trial because that always comes up whenever we talk to our community. So firstly, Tim, if there's any other updates beyond what you have already shared on the website, would you be able to comment on that? And also, what other options are there in terms of research or treatments in the clinic that could provide either an alternative or an addition to sodium valproate?
Okay, so I guess the update from the previous one is that our funders, the Medical Research Council, in view of the COVID causing a pause in the trial, have allowed us to extend recruitment into the middle of next year to give more patients and families the opportunity to take part. And that's both at the children's site, the Queen Elizabeth site, and our international colleagues as well. We're hoping, and Erin may be able to comment on this as well, that our adult site will be open in the next couple of months. Dr. Veronica Diaz has done sterling work reopening the Children's Hospital site and recruited somebody last month. And our international colleagues are hoping to be able to recruit either later this month or during August, which is great. In terms of other options, we absolutely don't want to put all our eggs in one basket. And our colleagues, Dr. Fumi Arano and others in America, are looking at setting up a clinical trial of another agent over there, possibly dantrolene at that point. And all the while in the background, we're working at potential other products, possibly such as liraglutide and things for the future to have a look at. And as you know, Prof. Fumi Arano is continuing to work on gene therapy, and we're hoping that at the end of the Treat Wolfram clinical trial of valproate, by that time, with a bit of luck, a gene therapy trial might become available. But these things, it's so difficult to tell. There are so many unknowns. I can pass over to Veronica, who can perhaps give a bit of the children's experience, if that's okay.
Just trying to unmute myself. I still haven't quite got to grips with the technology. So as Tim said, we were on a pause, obviously, with COVID and other issues, and we're now back on track. So we recruited we recruited a patient, in fact, gosh, just under a month ago now, back onto the trial. So we're very hopeful that we can continue to recruit young people at the children's. I'm very hopeful. I don't know if Ben is
Ben's not. Erin is from the adult side, and okay. Erin, you may have been involved in other research trials as well, so you may have an idea about UHB and them reopening.
I think it's still in the process. Some of the applications are going back in to kind of reinitiate services. I think I mean I don't know exactly when that's going to happen, but I can certainly have a word with Ben, who's been a bit more direct in that, and see what he's saying. My understanding is that, as I say, the applications are kind of going back into sort of restart trials. So hopefully soon, but I can get some clarity from Ben.
That's exactly right. Yeah, that's what he said to me as well. And the other person on the call here, who's Denise Williams, our medical geneticist, Denise, you may have an overview about trials in lots of different areas in rare diseases, and I just wondered if you have a feel for across all the diseases that you work on about those rare disease trials. Are they restarting again? Do you know of?
It's exactly the same as Wolfram, that they've been on hold and that they're restarting. So, yeah.
Okay.
Is there any update from the adult side? Erin, would you like to comment?
Sorry, what? So it's yeah, the same thing really. We're just as I said before, we're you know, I'm not directly involved, but I can have a word with Ben. But certainly things are. The hope is that this will gradually be opening up. Some of the applications are going back in to restart following the COVID. Everything was sort of put on the pause really, mostly. But I can get some clarity from Ben.
I think the other thing is that Ben has co-opted a few other people into the adult study. So I have an honorary contract with UHB, and then another colleague who's an adult endocrinologist is also going to try and help with recruitment at UHB as well.
It might just be worth me adding as well. University Hospital of Birmingham during the COVID first wave had a lot of admissions with that, and that they've done a fantastic job in recruiting people to COVID trials for new treatments for the COVID, and now the vaccine trials. And in fact, Erin may correct me, but University Hospital of Birmingham is one of the biggest recruiters to the vaccine trials, and they're making a real impact on trying to develop some treatments for COVID, which is fantastic. As a result, some other treatments have had to be put on hold for that. But now, as the number of patients goes down, thankfully, this bit of the pandemic is getting over, those trials are restarting again. And I know that Treat Wolfram has been being prioritised as a restart trial because that there aren't any other treatments available in the condition.
Thank you, that's great. Thank you very much for everyone's comments there. So now I'd like to move to clinics, and again it's a kind of similar type of question, which is how are the WS clinics going to progress moving forwards? Are patients likely to experience delays or cancellations, and if so, what could they do to help cope with that?
Can I jump in? Oh, Tim,
yeah,
is that okay? Or
yeah,
Tim, do you want to go for it?
Veronica, you go, because you put that document together that you sent to me. So do you want to start?
So Tim, Jodie and I have been working on how we can move this forward. So I think it's clear from some of the conversations we've had with families and also between ourselves that actually this is the new world order, and that some aspects of virtual clinics will need to keep moving it forward. And what we're trying to figure out, and what we've put together just internally, and probably will want to discuss with young people and their families how it would work for them, is trying to minimize the amount of time that you come to clinic. What are the best aspects of clinic for you, and what are the, I know that for a lot of people it's the waiting around the waiting around is the rubbish bit, and also having to spend 2 days in hospital. So we are going to try and minimize the amount of time that people have to stay in hospital, and it may be that you come up for your actual investigations, which can't be done locally, but some of the clinician time is done more virtually. And then the other things are around the fact that actually these are specialised clinics, so we are not aiming from a children's perspective to cancel or postpone any of our clinics. They are going to run as planned. I think from the adult side, and I think Erin and Jodie will be able to update a bit more from that point, they're doing a lot more virtual work as well, so they're trying to move as much stuff virtually that is safe, but keeping the best bits of the face-to-face contact that you have in clinic, if there are any best bits, obviously.
Yeah, I mean, last month, sorry, May, we had the Zoom WS clinics. We did it via Zoom, and it seemed to work really well. It was the first time I'd been involved in that. but I think generally for most it was pretty useful. It wasn't, you know, at times we had to kind of sort of revert to using the telephone, but actually I think it was still you know, it's still preferable to a completely missed appointment. And yeah, you know, I think we're sort of optimistic about potentially needing that. You know, if that were needed in the future as well, that may be something that could potentially be looked at as well. So yeah, I think the feedback was very good too.
Thank you, Erin. That's great to know, and I'm really grateful for you and Ben for keeping the clinics going, especially when the Centre for Rare Diseases is being closed for the last 3 months as well. So that's really great to do that. There's a comment on the chat, Gina, from Chris told me, saying Zoom is great, but have you thought about Google Meet, because it automatically creates subtitles, excellent for hearing impaired participants and also free. So thank you, Chris. That's a great suggestion. We'll take it forward, and what we tend to do with these ones is experiment amongst ourselves first. So if we have any complete disasters, it's only ourselves that are affected. But we will give it a go, and we'll hopefully by the time of the next webinar let you know how we get on with it. But we're always grateful for these suggestions for remote meetings.
Can I add something here?
Really, yes.
Sorry, I've just unmuted myself. I just wanted to let you know that the plan is for the next adult clinic in July. Again, is going ahead via a virtual clinic. We actually use video, not Zoom. Sorry, Erin. And the reason for that is it doesn't involve patients needing to download anything first, which obviously can add to the complications. So as far as I'm aware, patients get emailed a link and then they click on it. So the plan is that the next adult clinic, which is actually in 2 weeks' time, is going to be run via video.
That's great, thank you. Any other points on clinics before we move from that topic? No? Okay, so the next question that I have is what will happen with the WUF conference in September? And for this, I'm going to invite Tracy to speak first.
Hi, yeah, so the plan is already in place. We've cancelled, in a way, the conference for this year. We've moved it to a virtual conference. Jodie and I have already discussed how we would plan to do this and the speakers and everything. So once we've actually got everything finalised, we will start to let the WS community know, and it'll be a case probably of having different time slots throughout the day. Still on the 26th of September. We might have a few extra presentations the weekend before, if we can get the doctors to give up their time to do the conference presentations. So this year it's going to be a virtual. We'll see how it goes, but next year, hopefully, everything willing, we'll be back to meeting up and seeing everyone live. So it's just a case of watch this space, watch out on your emails, the website and social media for the updates and everything. So
great, thanks Tracy. And have you got any thoughts on when people can expect to see sort of a programme or more information?
It will start coming out at the end of August, beginning of September. So
great, thank you.
Don't want to give too much notice because otherwise they'll forget about it all. But what we probably will do is ask for people to register to which presentations they would like to watch, and then we'll send them the link for each presentation, so they can dip in and out and watch what they want. So
thank you. So I'm now going to move to we had a number of questions on symptoms. We've got a couple of minutes left, so I'm just going to move to one of those questions on symptoms, which is are balance issues a recognised symptom of WS? Or are they simply connected to having diabetes or being older or some other factor? Tim, is that something you could?
I probably ought to defer to Erin first, as I'm my adult neurology colleague, but then I'll come in afterwards if that would help.
Certainly. Erin?
Yeah, so balance issues can be a part of Wolfram's syndrome, and there's a few reasons really for that. So our balance, the way we walk and sort of conduct ourselves are kind of sort of depend on a few systems all working well and in tandem. And some of those include, you know, having sensory inputs. We rely to a degree for our balance on sensory input from our eyes, from our ears, We also rely on the sensory input from our feet and the balance systems in our brain. And so what can happen with Wolfram's is obviously, diabetes can, is a part of that. And so people can get things like diabetic neuropathy. So they can get a neuropathy that then, has an impact on that sensory perception, if you like, from the feet. But also, obviously, we've got the visual side of things. That vision is obviously a clear issue with Wolfram, as is the other factor, which is changes within the part of the brain that's involved or plays a role in balance. And so there's a number of reasons, all of which are quite significant for that people with WS may have issues with balance. In terms of how we manage those, I mean, a lot of them are kind of, looking at the individual areas. So, obviously diabetic control can be useful, trying to limit things like diabetic neuropathy. Obviously things like, guide dogs or seeing eye dogs, with regard to the vision side of things. And equally, having kind of physio input and OT input can be useful to try and mitigate those issues, really, and try to minimise them.
That's brilliant, thank you. And I guess you mentioned diabetes, Gina, although that's not so much balance, but is it worth, Susan, if you've got just 1 minute, just explaining why we get worried about glucose is sort of like over 20 or something like that? Is that worth, are you happy to do that, Susan?
Yeah. Once our blood glucoses are quite high, like we're saying the 20s, you're at more risk of infections or not recovering from any illness. So it's really important that we try to keep our blood glucose in target, and also we're worried about this thing called ketones. So we do say to any young people that are running high blood glucose, it's really important that you check for ketones if your blood sugars are 14 or higher. And obviously, if you've got ketones over 0.6, you do need to contact your diabetes team for advice. But the main thing, obviously, as we were saying, is you are at more risk of getting infections or not recovering as quickly if you are running high blood glucose.
Yeah. Thank you, Susan. Gina, thanks. That's great.
Thank you, Susan. Sorry, thank you, Susan. To follow up on that point, one of the community has talked about their glucose levels being up during COVID-19. Is that something you're seeing across patients, and what are the main reasons for that?
Sorry. And we haven't here at the Children's Hospital, to be honest, and we haven't really seen high blood glucose because of COVID. It could be due to stress. It could also be due to that if you're shielding, you're not as physical, you're not moving around as much, and also the fact that, as we were saying earlier, sitting around eating. There's lots of reasons you could be running your blood glucose high, but stress has a big effect on glucose control. So if you are anxious during this time, it will affect your blood glucose.
Thank you. Thanks for that, Susan. Well, we're now at 3 o'clock, which is the end of our session. So I'd like to thank everybody for joining us this afternoon, particularly to our speakers and our experts for their contributions. I'm sure everyone's found the session helpful. Before we close, I just want to say there will be a link that will be sent out to all of our community for a short feedback poll. Please can you take the 2 minutes, and it really is 2 minutes, to complete that, because that your feedback really helps us to make the sessions as valuable as possible. So on behalf of everyone at WSUK, thanks very much for joining, and have a good weekend.